So Arshad, you started in Bangladesh. You helped build one of the biggest telehealth companies there. What made you decide to come back to Sri Lanka?
Well, the whys basically, right? Two whys.
Exactly.
Shamindra. One's a personal one, the other is more a community-driven one, like you were mentioning earlier, the altruistic one. The personal one is, I was one day stuck going back from office to the apartment. My mother called me and she was like, she needed medicine. And she was like, can you bring it down from Bangladesh? I sat there thinking, if my mother can't go out and get medicine when I'm not at home, how many other people are going to be suffering? So that was more like my first why in terms of why Flash Health. Right? The second one was a bit of an interesting one. The solution was solving a problem at scale. Right? No wait times, people find it a bit more convenient. And this kind of struck, we are putting all this effort in building healthcare for another country. Why not our Maubima, our country? Right?
You can make the same argument for many industries.
Exactly. Money is one thing. Yes, there's a large population and the commercial angle looks great, but then again, the impact is when it touches your soul. And that's Sri Lanka, that's home. So that was my second why.
And you could have started any business, but you chose Flash. Why exactly? How did you... What was your process in identifying the gap? Obviously, you said that there's a personal touch to it as well, but at the end of the day, it is a business. So you should have done your research to see whether this is a viable business.
Yeah.
Could you walk us through that initial phase where you studied the market and then formulated the MVP for what Flash was at the very beginning?
Sure. So when I got back here, one of my promises to my dad was that I would do my MBA. Right. So I kind of took that challenge upon, and wasn't something I wanted to do, let's be honest. But I was like, if I'm going to do it, might as well have two birds hit in one stone, right?
All right.
So I used that MBA research to actually do the market research for Flash.
All right. So this started out as a MBA
program.
Okay.
Yeah. So my thesis was Flash, literally.
Okay.
Right? So the market, when I was doing some research on telemedicine, I actually wrote the paper on telemedicine adoption in urban cities and why it actually hadn't gone great as to what the solution. The actual solution is brilliant, but market adoption is really slow. There were little fundamental factors, right? But one factor stood out significantly, which is element of touch. Because whenever I spoke to the people in terms of telemedicine, they would say, Dr. Kohumada Danaganne Mage vitals allan network. So that element of touch played a significant role in people's perception of what a business is. And it kind of also validated my learning in Bangladesh that telemedicine is great as a service, but without a physical interaction, people don't build trust in the business. So instead of me starting telemedicine in Sri Lanka,
right,
I thought, what is the one service that I can build trust? I will have a physical interaction with. Medicine, the most common thing that happens every month at a household. So that was my thought process of, okay, telemedicine comes later down the line. It's not the first thing.
Okay.
So you get medicine, get them to trust the brand, because healthcare is a very trust-driven brand. It's not something that you can start today and say, yes, I'm doing a great service. People need time to believe in you. So when we started medicine, we started all these little nuances on how we can keep the engagement going, make sure that they keep remembering us in terms of the daily, routine. And that's when we slowly started bringing other verticals like telemedicine, home lab services into the whole ecosystem. The basic MVP was get medicine delivered to your house and have a piece of our brand at your place.
So at the inception, you were a pharmacy, cloud pharmacy,
online pharmacy.
How did you evolve into the digital layer where you brought in the Flash Health app and all the lab integrations and the telemedical doctor consultations aspect of it? What was the evolution like?
We always...
So the delivery MVP, the delivery service, we started this at when? Which year?
2019,
2020, all right. So after how much of a time gap from you launching your MVP, did you evolve the business from being a cloud pharmacy to one a bit more fully fledged in terms of technology and the telemedical aspect?
So I had this personal goal at that time, Shamindra, 1,000 customers.
Same.
When I had my first 1,000 customers, I will look at building an app, is what I told.
All right.
When I get the 5,000, I'll look at getting another service in, right? But my personal choice to know the MVP worked was to do the first 500 deliveries by myself.
All right.
So that was like the whole stage by stage.
Step by step.
Yeah. And I can tell you now, the first 1,000 is the hardest. Really hard. So that's been an evolving journey. So like you said, we always had the vision of where we wanted to go to. We said we wanted to build an ecosystem.
We'll get there soon.
Yeah.
Yeah.
So that was the whole idea.
All right. So you rolled out the digital layer, the app. As by the app I mean the doctor consultations and your whole medical records in one place. You launched that. One key insight of mine, there are many similar apps coming up in the Sri Lankan market. But they seem to not understand that technology isn't a moat when it comes to healthcare. Could you elaborate on that?
Yeah. So most people who are kind of coming up with the telemedicine platform like to put 2 plus 2 and call it 4 very quickly, right? And that's okay. That's a MVP. You can get to 4. There's more than one ways to get to 4 is what I tell people. It's not wrong they're doing it. It's okay. But it comes with a very limited number of aspects that you can do with it. Let's say you want to innovate in that space, you can't. Let's say if you're going to build something around the whole telemedicine vertical,
exactly.
If you don't control every single element of it, right, it becomes really hard to innovate. I'll give you some examples. Most people try to get a third party like Twilio or an Agora or a Zenbird to do the video streaming service of the telemedicine consultation. Or they get, let's say, some people do it in WhatsApp, some people do it on Google Meet, Zoom.
Yeah.
It's okay, nothing wrong. But what you need to realize is you're using someone else's ecosystem.
And infrastructure.
Yeah. Concerns like privacy, compliance, all of this will eventually start coming when you try to scale.
When you scale.
Right? What you need to be doing is to get to 4, it's 1 plus 1 plus 1 plus 1 to get to 4, if you're doing it right.
Elaborate.
Which means the whole video streaming service in Flash today, it's all built in-house. We don't use any third party. The entire encryption of the call is secured. That allows us to also innovate with bringing in Netflix compression technique so that in Sri Lankan network, our calls will connect even in low bandwidth areas. And Agora or a Zenbird will have low threshold limits.
One thing I noticed about your app is it just loads super fast. And that's an insight that I extracted from what you build is that it's not apparent to the user.
No.
But to someone like myself that's also building in this space, I picked up on it, and that's a brilliant effort made that.
Because it's the experience, right? That's what evolution on technology showed us. Speed. Why does industries keep going from 3G to 4G, 4G to 5G? Speed. That's one fundamental aspect most people miss. So by you owning the infrastructure, one is you get speed very quickly, and the second element is you get to customize that experience the way you want. So if you do a consultation on Flash today, there are some really cool features which allows you to capture vitals using your smart bands if you're using one. And if you don't have one, we use this concept called photoplethysmography, which kind of capture your pulse and mimics your heartbeat to the doctor.
Yeah.
So these are only things that you can innovate if you own the space.
You own the infrastructure, fully vertically.
Exactly.
Yeah. So technology itself, even though it reduces the friction to some extent, but in markets like Sri Lanka, technology itself is not, a huge value prop to the end user. That's the initial point I wanted you to elaborate on.
Yeah.
Starting out, so my whole, the business that I wanted to start initially was an EMR. That's when I pivoted into the digital health space. Yeah. So technology itself is not attractive of a value prop enough, even though how fast it is, even though how convenient it would make your life, still users won't adopt it at scale.
True.
First, since you have been through hell in terms of customer acquisition in Sri Lanka, could you elaborate on some points as to why that is?
So there's two angles to this, right? So just to throw a spanner into your perception over there.
Yeah.
Sri Lanka is known as one of the South Asian countries to adopt technology really quickly, right? I think it's not technology adoption that's the problem in Sri Lanka. It's what problem is it solving for them?
All right.
The narrative, right? Don't get me wrong. There are others who tried medicine delivery before.
There's multiple.
The narrative was not set right. Everyone looked at just providing a service. And they forgot the most fundamental aspect for technology adoption. If you don't keep it customer centric, no matter how good your technology is, no matter how sophisticated it is, it will kill the experience.
Now, would that even from a marketing perspective, I don't think the prior players, they had the correct strategy when it comes to acquiring users.
Correct.
The whole value prop they presented was convenience, but at the end of the day, convenience isn't the right strategy for the Sri Lankan market.
Yeah.
So, what is the right strategy?
The right strategy for the Sri Lankan market is actually an interesting take. It varies from segment to segment.
I'm all ears.
There's no one size fit all, right? So most people go and give a blanket. I mean, don't get me wrong. We made this mistake as well.
Yeah.
We kept saying healthcare simplified, convenience,
hassle free.
Yeah. Thing is, everyone was saying it.
Yeah.
Right? But what we realized was, when we spoke to certain segments of users, we understood very clearly that the narrative had to change. It's not just the messaging, it's also the language had to change. Right? So there's a certain audience that was price sensitive, so then how do you tackle a very price sensitive message? And in the language that they are comfortable with, in the most simplest language, taking all the noise out. Sometimes we get stuck with trying to explain them in the most complicated words.
Exactly.
That we feel smart to say it, but the end user is not getting anything.
Just to feed our own ego.
Exactly. Like that's the killer, right? That's the first killer.
Yeah.
Then there's another segment who loves convenience, right? But the challenge when you say it's convenient, their first thing is to benchmark you with everything that they go. And their first benchmark will be, I have a pharmacy right next door. Right? So that's their benchmark. They don't benchmark technology with technology. They benchmark experience with experience.
Yeah.
Right? So to that segment, you approach very differently. The value proposition is different. Right? Then you have the other segment, who is the urban working class, people who are really busy. And they are the caregivers of the family. To them you approach love, care, not convenience, not money. For them it's about how are you going to take care of their loved ones.
And I think that is one of the key market segments which Flash focuses on. Exactly. So from the genesis, from the start, from the outset of you starting Flash, how much time did it take you to get to that first 1,000 users?
Exactly 1 year and 3 months.
All right. And within that initial leg of the journey, how did you market your product to a user segment to whom this whole concept of cloud pharmacy is a novel idea?
Right. So initially we actually didn't know who to market to, who to target. I would be lying if I said I had a grand plan to go into take it to market. I didn't.
We all go into this blind.
Initially it was just a Facebook post.
Okay.
Right? Just a Facebook post. And what's the funny thing, the very first idea that we piloted was not medicine delivery, subscription medicine.
Okay.
We were only going to do cholesterol, pressure, and diabetic medication on a monthly subscription. That's it. It was never about all the medications you want.
And why didn't it work?
To the point, they didn't get the concept.
Okay.
No one believed in the whole subscription for medicine. Maybe we were a bit too early. It was way too blue ocean of a strategy. And that's when we realized, okay, we're going to have to get all the medicines going. Let's say we are going to deliver it to you. But one piece that we brought in from day one was express delivery. Because everyone loved speed, like I said, quick. And blessing in disguise, it aligned with our brand name, Flash.
Yeah.
Right? So from day one, we had express delivery. So what we would always say was medicine delivered in 2 hours. And finally, that started giving some traction. Most of our users early days were express users, not standard users.
All right. So from getting to 1,000 users, you decided to venture into the B2B2C arm of the business.
Yeah.
First is, why did you make the decision?
Mm-hmm.
And let's start with that. Why did you make the specific decision to go into the B2B aspect of the business? Why not have focus solely on the consumer-facing side?
Good question. So, when you're a startup, first thing that you need is survival instincts.
Exactly, yeah.
You got to learn to survive. If you're going to have to wait till you get to 1,000 users to get that revenue, you will die before you get there.
Something I say is, screw your mission if you don't have the money to stay afloat.
Exactly.
Does that make sense?
And I actually remembered, there's this book I had read, The
Right.
Zigzag Principle.
All right.
So, the route to getting to what you want to is not linear. You got to zigzag yourself to get to where you want to go. While B2B is not something I wanted to do initially, it's never a valued element of the business. It's the cash cow of the business. And we sat there thinking, we've got a pharmacy. Who else will need these products? And where can we get the cash in really quickly, really fast, and at volume? Corporates seemed like a really good element because no one was doing corporate medicine delivery. Because the admins were generally trying to walk up to the pharmacy and get something purchased.
Yeah.
So we kind of created a whole process around you can do B2B medicine procurement through our platform, which kind of pivoted us into that. And today we're growing. We supply to around 650 corporates monthly.
That's awesome. So, something brilliant about leading up to cashless OPD. Something brilliant about cashless OPD, which is this B2B service that you provide, is that, at least from a game theory perspective, it's a brilliant strategy that you come up with because everyone wins.
Yeah.
First of all, you win because basically you're getting paid to acquire users
Correct.
in bulk.
Yes.
Secondly, the insurance providers, they don't have to lose money on the OPD premiums, primary care premiums.
Yeah.
And then lastly, the employers, it's a win for them as well because it's saving 40 to 50% of their insurance budgets.
Correct.
So obviously, as brilliant as it is, there must have been a lot of research and testing and iteration when it came to the process of figuring out there is this problem, there is a gap in the market which we can fill. I won't know. The process which you took, I'm just exploiting you at this point.
Sure, of course.
I just want to know the process which you and your team took to figuring out and doing the research and launching this new product segment through Flash to the corporates. I want to know the learning process.
Sure. Yeah. So, in all honesty, Shamindra, it's not like we started off saying that we are going to do cashless OPD. Like, I'll be lying. But we knew we had to get into the insurance space. That was the end goal, right? Yeah. So we built the 3 verticals: medicine, labs, doctor consultations, and I think we were spending a year trying to sell wellness benefits as a package to corporates. And I remember going to more than 1,000 meetings, Shamindra, and none of them converted. And I eventually stumbled upon one customer who said, look, your solution is great, but it's not what I want. I'm looking for something to manage our OPD within the company. How would you change your product to look like that? So that kind of gave me a thought process. I was like, fine, at least one customer is engaging, so let's try to work around it. And we took 2 to 3 months to build a concept around it. Yeah. Finally, that customer never came on board.
All right. But that led to something bigger.
Yeah, and then that product sat there for a year. I didn't know it was solving a bigger problem. Yeah. But then eventually this guy who never got the product said, look, I don't need, my company is not going for it right now, but I've got a few others who may be interested, so I'll put you in touch. So I took the product to them and I remember signing on the very, very first customer. All right. And then he asked me this question of, so who is your competition on this? I was like, what do you mean? Like, insurance guys might hate you, right? Like, what? Why? It's like, because you're taking their OPD. I was like, what do you mean? Because we are not paying the insurance anymore, we are paying you. Yeah. And that's when I was like, maybe there's something to this. Maybe I've not been looking at it the right way.
You've been not looking at it deep enough.
Exactly. I was just looking at it at a very surface level. So I remember coming back and rethinking the strategy. That's when I started doing the research. How does OPD work? What's the market segment like? How much of money is being burnt?
Spent.
Yeah, and not being utilized. It was crazy. That's when I realized, okay, this product has legs, and blessing in disguise, we've been building for it all along, right? Because we always knew insurance was a space to get into, we just didn't know how. I think it goes back to that saying, Shamendra, have faith.
Things will fall in place.
It will fall in place.
Yeah. So, could you talk about where cashless OPD, could you first explain to the viewers what cashless OPD is?
Sure.
And where it is now? Yeah.
Absolutely. So cashless OPD is a corporate product. I think the simplest way to explain this is in corporate insurance, there are two components. You have an IPD, which is the inpatient, aka hospitalization cover.
Inward.
Exactly. Which you very unlikely will not use if you are young, right? It's pointless. They say 200, 300,000 hospitalization cover unless you have the married person who's got a wife pregnant.
Yeah,
It'll be useful. But the real component that gets used is the outpatient cover, which is OPD. Now, two problems here for the corporate is they have to pay the entire premium. When I say premium, the allocation in full to the insurer. So let's say, for example, you want to give 10,000 per year OPD cover and you have 100 staff, that's $1 million you need to pay upfront to the insurance. Two problems there. If the employee leaves the organization, there is no rebate back. If the employee underutilizes, there is no rebate as well. So the corporate genuinely loses there. So then what we kind of do is cashless OPD flips the model. So what we do today, we go to a corporate and we say, Shamendra, great, you've got 100 staff. That $1 million, keep the money with you. Don't pay us. Instead, just tell us you want to allocate 10,000 for this guy, 5,000 for the other guy, 25,000 for the other guy, not a problem. It's just digital allocations. Once that's done, see, all this time money has never left you. Money is still in your company, better cash flow for you, right? The employees get to do two kind of claim through our app. One we call a manual claim. Manual claim is the conventional process of them going out, buying the medicine from their pocket, from their money, submitting the claim bill. That too we kind of streamline like an Uber experience, showing what's happening to your claim, what the reviewer says. Whereas in today's insurance world, that doesn't happen. It's very like a black hole concept. You don't know what's happening. But that's not the sexy part. The sexy part is the cashless element. If the employee decides to use our medicine, our labs, or our doctor consultation, medicine will get delivered right to your home, while money never leaves your pocket.
Yeah.
You don't need to submit a claim. For you, the whole experience is cashless.
That's the beauty of it.
Yeah. And there's one use case. There are cases where employee not well, stuck at home, 24th she calls, doesn't have money to go out and see a doctor. Salary, right? Everyone is there. Yeah. She gets a doctor consultation. Possible dengue symptoms, send the phlebotomist home, get a blood sample, get that checked, does a follow-up consultation, and luckily no dengue, and send medicines to her house. All in the same day. She never left the house, never spent a dime from her pocket, didn't submit claim, didn't wait X number of days for a reimbursement. True cashless experience.
So, for the entrepreneurs out there, what you could say is basically, this is not something that was created out of intention, but things just fell into place.
Always is.
Yeah.
You have this grand idea when you start off. And entrepreneurship is that. Going into the unknown and coming out victorious. But the challenge is holding on to that faith till you get to that point.
And obviously there's a creative component to things as well, because you can't be so rigid as to, this is how I'm going to earn, make profit through this business. You have to be highly malleable.
Correct.
Yeah.
Correct.
So, I presume at the point of you launching cashless OPD, you probably had a team working on the Flash at that point of time?
Yeah.
So my question is, obviously these are two separate aspects of the business in some sense. So there is obviously a dilution in focus when it comes to what you're building. From a founder's perspective as an operator, and also from a team perspective, as in how you or a part of your staff as a product manager, how did you guys manage the process of building Flash, putting on the cashless OPD on top, whilst not diluting your focus and compromising on either end?
Great. So I think the only commodity that you face, that you have a problem in these kind of scenarios, is time.
Yeah.
Right. There's two ways that we kind of worked around it. Get faster or give more time.
Elaborate.
Right. So which means either longer hours or early starts.
All right.
Right. And figuring out if something is going to take 2 hours, how do you do it like in 30 minutes? And it's been this constant question for us whenever we come up with something. We ask, is this like the quickest way to do it, or is there a quicker way to do it? Because we are limited to resources, we are limited to what we can do. We can't take the focus off our key revenue drivers while innovating. It was a challenge. I think that's every business or every entrepreneur comes to that point where they have to give that level of input. Let's just say, let's put it this way. I think in an analogy perspective, you're pushed into the deep end all of a sudden, right? You don't have a choice. It's either you drown or you pedal faster, no matter how tired you are, until you get to the other side. So it's one of those moments how we got there.
So Sri Lanka as a market, like most of these Y Combinator videos, all these VCs, all the resources out there for Sri Lankan founders, which are of US Western origins, they stress on the fact to focus on one singular thing. But the issue when it comes to Sri Lankan startups, so any startup in an emerging market, is the depth of the market is not big enough to properly, drive significant revenue through one particular line of business. So you have to, by proxy, dilute your value prop. But there is a balance to it. Is there any mental model that you as a founder have when it comes to not going after the next shiny thing, shiny object syndrome, and just diluting your focus, for lack of a better word, whilst having some boundaries as to not go overboard?
That's actually a good one. First and foremost, you're right.
Yeah.
You have no idea the amount of times I've been turned out because they said my focus was too stretched thin.
Exactly.
Right? Yeah. It's mainly down to the depth of the market's availability, right? It's not there, so you can't just do one thing. You got to do multiple things. I think the way to do that, if you're doing multiple things, always make sure they all come together. So there's this speech about Steve Jobs on how he talks about connecting the dots backwards.
All right.
So that kind of really struck to me. So every step I take today, there's a question, even if it's the next shiny thing or not, my mental model on how I kind of say yes it is or no it's not, is that initiative or that task I'm going to take today, is it aligned with my greater vision?
Will it feed into the core business?
Exactly.
All right.
And you have to be ruthlessly honest about it.
Okay.
Right? You can't convince yourself to say no, it will work there. No. It's you ruthlessly be saying no, it's not. And
right.
If it's not, it's going to be a time waster for you. Right? And the second thing is, how much time is it going to need? Is it something that you can test really quickly and you'll get the concept? You know that. If it doesn't, if it's going to take a shorter period, let's test it by all means. Feed that little, ego in your system to say that I tried it didn't work, now I can move on.
And I learned something during that time.
Something will come out of it, right? But if it's going to cost you time and money, it's wise not to do it. Don't bet on it. It's too early to do that.
So, how many active users does Flash have at the moment?
So today our user base is around 45,000 and growing. We see an average of around 12 to 14% active users monthly.
This includes all the corporates. Okay.
Yeah.
So we can talk about marketing strategies, but I think the right question is, what are the constraints you currently face to grow your user base?
I think constraints, right now, Sri Lanka is going through a massive brain drain, Shamindra. The right skill sets of people, the right talent is not there in the market. While it's a problem, it also is an opportunity for the upcoming generation. Right? It's a massive void to be filled because everyone's left the country seeking better opportunities. That's become, I think, not just for me, for many businesses that I talk, many entrepreneurs, everyone's after the same thing. Do you know a good sales guy? Do you know a good operations guy? Do you know a good designer? Everyone's after that. So that's, I think, one thing. The second thing that comes into play is the whole government compliance around initiatives when it comes to healthcare.
It's non-existent, if you could make the description.
Yes. See, not to say wrong, I think there's a reason why regulatory frameworks are in place. It's so that you don't go beyond certain measures. Yes, but to innovate, if you don't innovate by taking that extra step, you really don't know if it's the right thing to do or not. I think even for today, if you wanted to go and like massively publicize and market, there are certain regulatory.
There are.
You can't, right?
Yeah.
So I think that's something that Sri Lanka should really adopt fast. While the government's or the current regime's narrative is let's digitize everything, which is great, if you don't put the road to digitization, it's just another buzzword in the market.
Yeah.
Right? I think that's the second thing that Sri Lanka is massively facing. Because most people will come into the market, they will test things out, and if it doesn't work, they're going to be shut down. So it's always that risk of, will I be shut down if I don't comply? But then again, what is there to comply?
Exactly. So when it comes to compliance and regulation, for example, I presume the latest telehealth guidelines, these were released with Flash itself as well, right? How do you involve the necessary authorities who honestly don't have an incentive to for lack of a better word, innovate in terms of regulation?
Yeah.
What is your strategy? What has your strategy been in terms of encouraging and pushing for regulation to be put through into the system? Because regulation at the end of the day is needed.
100%.
Yeah.
I think regulation is something that's definitely essential, right? So we also did even help on the medicine delivery guidelines as well. So all of this comes down to one thing, right? And the Western world call this lobbying. Right?
I didn't want to use that word.
Well, it is in a better word. Yeah, for a far better word it is. And how do we do that in Sri Lanka? Well, Sri Lanka is a market when you've proven with results, they start looking at you. And I go by this phrase, it's easier to say sorry than ask for permission.
That's something you first said to me the first time we met.
Yeah. It's easy to ask sorry than say ask for permission. So,
as long as you're staying within the moral and...
I mean, like, if you know a moral guide to say this will comply, this will not comply, this is what, I mean, it's not rocket science, right? It's common sense. If they say abusable drugs you can't deliver without a prescription, then how do you bring that into the digital world? It's not that you deliver it and say, no, I will deliver it. That doesn't work. So I think in Sri Lanka, how we kind of got to that was we made enough noise in the market to be heard. And you do that by, of course, your go-to-market strategies, you get people to use it, you show what you're doing, and this concept of building in public, who once one person actually advised me to do, has significantly made an impact there. So we've actually had authorities reaching out saying, we've seen your adverts, explain to us what you're doing.
At the end of the day, it is an essential service.
It is.
So there's always a dire necessity for such services.
100%. And every time I've gone to the authorities, all I've said is, look, I'm not trying to work against you. I'm trying to work with you. Tell me how.
So I just want to go back to a point which you made about brain drain. Could you elaborate on that? Why it is a constraint when it comes to growing the business?
See, great empires are built with generals. That's what I believe. And when you're building a business, especially a startup, you really need the
best of the best.
Best of the best, right? Because you're solving problems that has no right answers. You got to test, and the resilience, the whole works, the commitment that needs to be there. We are unfortunately left with the crowd who wants to do a 9 to 5. And that's okay, there's nothing wrong. There's nothing wrong. The problem is, you are left with lesser people who want to do the commitment of a startup and innovate.
Who want to take the risk.
Exactly. Which kind of leads to the rest of the people who are doing that, the smaller segment, to get burnt out. So I've got team members in our team who put in some crazy hours. I don't need to ask them, but they do it because for the love of the passion, right? But I can also see their burnout happening. Their family problems starting to arise slowly. Because at one point, someone's going to ask the family, why is this guy working so much? So this brain drain has left us to that. Someone could do things in 2 people's job, now he needs like 4 people.
That by 2 people's job now only needs 4 people, it's because of the quality of talent.
Correct.
All right. You could make the same argument for many industries.
Yeah.
Doctors.
Everyone's
nurses.
struggling.
Yeah.
Everyone's struggling.
So, I mean, since you're talking about crises,
It's topic of the town now.
yeah, with the ongoing war and the hike in fuel prices, and how have you been navigating? Because I presume this is not the first time you've been through, been through this.
No.
I would say this is the second or third.
Yeah.
So by now you probably set the systems, and I might be wrong. You probably set the systems, and you have some tacit innate learning as to how to navigate as well.
Yeah.
What would your advice be to anyone, any founder that's focusing on Sri Lanka? What would your advice be on how to navigate through any crisis for that matter?
I mean, the only answer I have to this is, and like I said, after multiple learnings, every crisis poses an opportunity. I know we have no petrol, but guess what campaign we are running today? Free medicine delivery. Why charge when you can give something for free and get them to experience the service, because right now is when they need it.
And that in turn, sometimes crisis could be,
Always
always opportunities in disguise.
It's about how you learn to look at it, right?
So, leading up from crisis, like the ideal, I think your business is at a stage where you can ideally expand out of Sri Lanka.
Could say that, yes. Yeah, okay.
I mean, from a business standpoint, from a monetary standpoint, it makes sense. I think any investor would push you towards that as well.
I've been asked.
Yeah. But I see that you have a vision to first have a strong foothold within Sri Lanka. What is it that I or we are not seeing that you are seeing?
Sri Lanka is a beautiful market with a lot of potential. We are building traction and momentum is starting to be gained. If I take the feet off the pedal now, that momentum will slow down. And we're at this point where we are the market leaders in this at this stage. We want to try and acquire as much as possible in this space. I think the vision that I'm seeing here is, if you do Sri Lanka right, I think there are certain more things that we will fine tune in the future, which we are working on some really interesting projects, because we are not looking at this space as just as let's give a cashless OPD or a medicine delivery or a lab. The real underlying element in this, as a user for you, are we helping you manage your health efficiently?
I see that you have a very long-term vision, not just from a business standpoint, but from a health primary care standpoint as well.
Always keep the customer the center point, right?
Yeah. So from a primary healthcare innovation standpoint, I know it's what you're building is not just a data layer, an app, or cloud pharmacy delivery. I don't know if you want to.
Yeah, no, I think it's good.
If you could give us a glimpse of what the vision is.
Sure.
You could rather without saying what the vision is, you could say what the ultimate problem you're trying to solve is.
The ultimate problem that we're trying to solve is healthy longevity. Right? So everyone wants to live long.
Yeah.
Right? But then again, most people don't get that chance because of bad health habits and no proper medication. There. And I think our lifespan has been increasing, because of medication and the research being done there. But the problem is, medication is helping you live longer, but not in a healthier way.
It's reactive.
Yeah. And I don't know if you read this book called Ikigai.
I'm not. I'm yet to.
Yeah, you should. It's they talk about the people in Okinawa in Japan who are about 130, 120 years old and how they still lead a very happy life. This all drills down to the whole lifestyle medicine concept, the 6 pillars, right?
Yeah.
And you see, that's what Flash is kind of basing itself out of. That's the model framework. From movement to society, medication, stress, exactly. And we're trying to bring in the element of how users will be engaged to those verticals. Putting it as theory as opposed to getting them to engage in those verticals are two different things. Now, one of the things that we want to make the future of healthcare in Sri Lanka, for us to paint you a picture like this, right? Imagine you wake up one day, the apps there, it's like their whole own little health assistant that's going to tell you, look, you've not done your lipid profile check. We are tracking your biomarkers. I think you're due for a test next week. Phlebotomist will arrive at your home at X amount of time. And you can just go about with your day. They come, they collect your samples, your report comes in the evening, and the doctor has already reviewed it and he gives his opinion. You just need to act upon it. Right? You don't need to order medicine, it'll come to your doorstep. All of this is seamless, and the better thing is all of this, when we explain this narrative, they all think, oh, it's going to be costly. I think it's going to be 20% cheaper.
It is.
Right? When you have economies at scale, all of this will be cheaper. And we become this whole unspoken thread across the nation that is giving access to healthcare, not just from a service level, but also from a data level, which means any pharmacy, any clinic you go to, your medical records are there. See, the West has done this with the NHS. You can go to any hospital, and when you get admitted, they know who's the doctor, what they diagnose, what were the symptoms, what medications. Sri Lanka's healthcare data is massively siloed. And you know the amount of deaths that happens because of wrong analysis, because of no proper historical data. Those stats don't come out. We can prevent that.
That is ultimately the long-term vision for any startup in this space.
Yeah.
Data continuity is the main problem I see which you're trying to solve at now. You're still very early, but I see where you're going. When it comes to getting people to adopt these systems, I'm talking from a very macro sense. There needs to be incentives. There needs to be incentives set for each and every user, the patient, but also the provider. However, currently there is no proper incentive for providers. There could be for patients, depending on the person. But for providers, not the younger crowd, they are more attuned to digital innovation, but the key players, they are still yet to adopt.
Yeah.
What does your strategy mean? Are you focusing on the younger generation because they are going to be the patients of the future, or are you working on something now to get more people involved?
Answer is yes.
Okay.
We're working on something that's really interesting.
Okay.
If you see, there are this whole element of healthy lifestyle living. I would say it's a lifestyle choice. And many people are starting to make this whole woke mentality, this concept. While there are certain things I agree with, there are certain things I don't. It also has brought the opportunity of them giving prominence to these kind of topics of healthy lifestyle and all.
It is the talk of the town in the US.
It is.
Longevity is in full swing. Yeah.
And very soon that's going to come here as well. So we being early in that space, trying to show that we are positioning ourselves as one of those players that can facilitate, support, guide, and fulfill. We become the market choice. Right? So this has been, I think, for us, the whole longevity game. There are different features that we're working on these fulfill, support, guide elements. There are separate features that we are planning on as of today. I don't think we'll get it right on the first go, I'll be very honest. We will make a ton of mistakes like we've always done. But one thing I am pretty certain is we'll get there.
And my insight is that in Sri Lanka, this particular market is yet to be created.
Blue oceans.
It's a blue ocean. So when the time comes, I am pretty confident the opportunity is there for companies to swoop in and exactly. So one thing about team building, this is for myself and the entrepreneurs out there. As you said, it's hard to incentivize the high slope people to come on board. What has your strategy been?
Find really hungry young individuals.
Is hunger enough? Is it the drive enough?
That is my core element. If you're hungry enough, then you are willing to learn.
Yeah.
90% of Flash were interns once upon a time.
All right.
Today, they are leads, managers driving the business in my absence. So that model, I mean, don't get me wrong, I make it sound easy, it's not.
No,
I get you. Amount of, like, for every 10 interns, maybe 2 will be really good. You take them, you train them, you harness them. And my strategy has always been, forget that you're an intern from day one. I see you as a manager potential, so I'm going to treat you like a manager from today.
You're going to give them the autonomy.
I'll give you the autonomy. But I'll also hold you accountable to it.
Yeah.
Don't try. Most people make the mistake. There's an intern. Give them 2 weeks to learn. Another week to they're making mistakes. I'm like no. You want to play the big boy game? You start today. So that's something we've always pushed every single person who's come on board. Most leave because they feel it's pressured, and that's okay. And I tell our HR it's better they leave early than we wasting a lot more time.
And their time as well.
Their time as well. It's not. It just wasn't for them. I don't think they're bad people. None of them are bad people. It's just that it's not their choice, and this is not for everyone. So when it comes to building a team, I think it's about nurturing the right people on, and when you nurture them, train.
And train them to be the high performers that you want to be in your company.
Correct. Okay. And you show that by you yourself being vulnerable. Even we today aren't perfect. I'm still learning. There are people I still sit and go like, holy crap, I never thought about it this way. So we are still learning. So what are we to ask from them to be perfect?
Exactly. Yeah.
My question, my ask to them is fail. Fail quick, fail fast, but
embrace failure.
Embrace failure.
Yeah.
Stop. Don't give me excuses. Don't tell me no. Don't tell me why it can't be done. Because it can.
Yeah.
You just have to figure out how.
And I want to jump roads into a different part of business in terms of startups. Something you mentioned early on to me is that money is cheap.
Yeah.
But it is not a concept that is, it is a counterintuitive concept to the average Sri Lankan guy. Could you explain that? Because one of the most common perceptions when it comes to investment and money is that is the lifeblood of a business. That is the air you need to breathe first in order for business to grow. But that simply isn't the case.
Yeah.
Sometimes that could be the thing that kills your business as well.
Absolutely.
Yeah.
Absolutely.
So could you just elaborate?
Sure. So money is cheap, equity is expensive. That's the whole statement.
Yeah.
Right? Early on, most people think raising is the first, that's like success point, right? And what they end up doing is diluting the business a bit too much. Well, that's okay. That may be a choice of what you want to do. But if you believe in your idea to be a $10 million, $100 million based valuation, and you believe in that idea.
Almost delusional to some aspect. Yeah.
Which I think is, if you see the crazy ones, they have been. Like you said, delusion got us to the moon.
Yeah.
Right? So I think when you know that you're worth 100 million, would you settle for lesser stake in that?
Have you made the same mistakes?
I have. In my earlier maneuvers, I have done that. I have let go more than what I should have, then realized, oh my God, this was worth way more. Should have held on to it. Money is cheap, which means you can go to a bank, borrow it, it's available. Equity, once given, you can't get it back unless you have to buy it back at a higher value.
Multiple, yeah.
Right? So money is cheap, equity is expensive.
From everything so far during our conversation, we spoke about strategy. We spoke about how you started without seeing the end in front of you.
Yeah.
And we spoke about some business aspects of things as well. I don't want you to give some generic advice to the viewer saying, persistence, resilience. Even though that's true.
Yeah.
What I want you to do is to end things off. What would you say to Arshad from 8 to 10 years ago who has no idea what he is about to embark on? You've been through the mill. You know where you went wrong, where you went right. You know the mistakes, the ups and the downs. What's the one key specific advice you would give to yourself from 10 years ago?
Make more mistakes. I was a bit too risk averse. Until I got to the whole startup game and changed that mentality, I was massively risk averse. Most might tell I've done a lot of things, but then again, I don't think I did enough. So it's a bit of a two-framed question, isn't it, Chandra? Because one answer that comes to my head is saying, I wouldn't do it any differently.
The romantic version.
Yeah, I got to where I am I talk as if got to the 100 space, I'm not. That's long in that journey. But I am who I am today because of the failures and the mistakes I made. if I go back 10 years and say, oh, don't do this mistake so you wouldn't do that, then it's not the Arshad you will be seeing today. The other side of it is make more mistakes, because that's becoming evidently clear. The more mistakes you make, the more things you will learn, the more scars on the back to say, hey, don't do it that way. Maybe Flash will be different if I had done that earlier on. Because there were stages throughout building Flash where I kind of was like, nah, let's not do it. I'm too afraid. What if it goes wrong? And it went wrong, much worse. I'd rather have tried it and made it go wrong.
So, everything is a leap of faith.
Everything is. There's no discount to that statement.
Well, Arshad, thank you very much. It was an awesome conversation.
Like, it's always a pleasure having chat with you, man.
Cheers, man. This episode was brought to you by Adam. Adam is a digital healthcare clinic for men, and currently it specializes in hair loss. Hair loss is a condition commonly experienced by a lot of men in Sri Lanka. But people don't know what the right treatments are. Most of them are uninformed, and sometimes most of them are misinformed. What Adam does is it connects you to a licensed doctor who will prescribe you the right treatment. And that treatment will be delivered straight to your door. If you want to book a consultation with us, go to www.theadamclinic.com. The link will be in the description below.